In this video, I'm going to be covering antivirals and how they pertain to possible prescription writing questions on the virtual OSCE. So here, again, we'll be covering what they are, what common indications are, and we'll also go over a sample case where antivirals are appropriately prescribed for the patient. So to begin, what are viruses? So viruses are obligate intracellular parasites that rely on the host cellular machinery to replicate. So what does that mean? So it means basically that viruses are a bag of genetic material, either DNA or RNA, encapsulated within a protein coat called a capsid, and they also might sometimes contain a lipid envelope. And these virus particles basically infect the host cell and use its enzymes, use its metabolism to facilitate the reproduction of more virus particles. So here is an example of HSV1. So this is herpes simplex virus 1, and this is its life cycle, and this is pretty representative of other viruses. So just to simplify, so imagine this is the HSV1 virus. It'll attach onto the host cell, and it'll fuse into the host cell. And then from there, it'll use all of its machinery, so it'll use all of its enzymes to produce messenger RNAs, and these will be converted into proteins through the ribosomes of the host cell. And then once the proteins are formed, it'll go to the endoplasmic reticulum, and it'll form into mature virus particles, and then it'll leave through exocytosis. And then these are the mature virus particles that will be used to infect further host cells, and it'll cause symptoms in the host. So as the virus infection progresses, the host will experience more and more symptoms as the viruses propagate. And so antivirals are drugs that target steps of the virus replication cycle to prevent the propagation of new virions or virus particles. And so antivirals essentially stop specific steps in the virus replication cycle to prevent the advanced development of viral infection and to hopefully stop the development of symptoms within the host. In dentistry, antivirals are commonly used in two aspects. So first, they're used topically to relieve viral orofacial lesions. So for example, a common one are cold sores. So cold sores are a result of herpes simplex virus 1 infection. And so commonly we prescribe topical antiviral cream to prevent the spread of these cold sores. Or they may also be used systemically when there are prodrome symptoms. So what are prodrome symptoms? Prodrome symptoms are symptoms that develop prior to the characteristic virus infection or the characteristic symptoms of a virus infection. So an example of this would be shingles. So shingles arise from varicella zoster virus infection. And usually what they do is they affect one nerve and all of its associated areas of the skin. And so this is called a dermatome. So a nerve plus all of its innervated area is called a dermatome. And usually when we have a herpes zoster infection or shingles, we will experience pain or neuralgia prior to the onset of the shingles developing. And so this would be an example of a prodrome symptom. So common indications for antiviral infections or antiviral medications are: 1, primary herpetic gingival stomatitis. So this is the first infection of a herpes virus in usually pediatric patients. In orofacial herpetic lesions, as I mentioned previously, so things like herpes simplex virus 1, cold sore infections, we use antiviral creams to relieve and advance the healing of these lesions, as well as in herpes zoster infections. So for shingles, for example, we may prescribe antiviral medication systemically during the prodrome phase to prevent the further development of viral infection. So here we'll go over a sample case of when an antiviral might be prescribed. So here we have a 25-year-old female whose chief complaint is that she has a cold sore that's really bothering her. The history of the chief complaint is that she first noticed this yesterday, and that the patient states that she's experiencing these lesions occasionally, so they do recur, and she first noticed them when she was a young child. She receives routine dental care, and clinically we see focal clusters of pseudomembranous ulcerations, and we also see crusting. So just to walk you through this, so we know that this is a herpes simplex virus 1 or cold sore because, well, 1, it's described in the question, but also because of the clinical presentation. So if they don't tell you explicitly that it's going to be a cold sore, you can kind of figure out that this is likely a cold sore based on, one, the image, and two, how the history of the patient presents. So in the history, the patient says that she's experienced these lesions occasionally, and so they reoccur. It's not the first time she's experienced them. And also that she first noticed them as a young child. And so usually cold sores arise from recurrent herpes infection, and they occur after a patient's already been infected, usually in childhood, by herpes. And so a presentation like this with sores like this is very characteristic of herpes simplex, a recurrent herpes simplex infection. Clinically, this is very characteristic of what a cold sore or recurrent herpes infection might look like, because we see there are focal clusters right here, right here, right here, of pseudomembranous ulcerations. So a pseudomembrane is basically this yellow part that forms on top of the ulcer. And what happens is this pseudomembrane bursts and it'll form areas of scarring like here. You'll see areas of scarring as a result of the bursting of the pseudomembrane, and this will cause crusting or scabbing of the wound. And so this is a very characteristic presentation of herpes simplex virus infection, of recurrent herpes infection. And so you can confidently diagnose this as a cold sore or a recurrent herpes simplex infection. And so because this is early on in the infection and because the patient is symptomatic, we can prescribe the patient an antiviral cream to eliminate the patient's symptoms and to facilitate healing. And so the most characteristic prescription that we write as dentists for topical antivirals would be acyclovir. And so this comes in a strength of 5%, and we dispense 5 grams of topical cream, and we tell the patient to apply this cream 5 times daily for 4 days. And because this is just a one-off occasion, we include 0 repeats. And so acyclovir is the most common topical antiviral cream that we use, and it's commonly used for cold sores or recurrent herpes simplex infection. So this is kind of a characteristic case where we prescribe an antiviral cream, and I hope this helps.